Which of the following is the most appropriate initial action for a nurse when a patient develops signs of anaphylaxis after receiving penicillin? Correct answer is option B. A patient with heart failure is prescribed furosemide. Which electrolyte imbalance should the nurse monitor for most closely? Correct answer is option B. Hypokalemia. A diabetic patient has a blood glucose level of 55 and is confused but able to swallow. What is the nurse's best action? Correct answer is option B. A post-op patient suddenly develops shortness of breath, tachycardia and chest pain. The nurse suspects a pulmonary embolism. What is the priority intervention? Correct answer is option B. A patient with a history of alcoholism is admitted with confusion, ataxia and nystagmus. The nurse suspects Wernicke encephalopathy. Which treatment should be anticipated? Correct answer is option B. A patient with Parkinson's disease is taking levodopa carbidopa. Which instruction is most important? Correct answer is option A. Avoid high protein meals when taking the drug. A patient with a TBI has a Glasgow Coma Scale score of 6. What is the nurse's priority concern? Correct answer is option A. Risk for aspiration. A patient with a potassium level of 6.8 is prescribed sodium polystyrene sulfonate. What is the nurse priority monitoring parameter? Correct answer is option D. A patient with cirrhosis develops asterixis. What complication should the nurse suspect? Correct answer is option A. Hepatic encephalopathy. A patient receiving a blood transfusion develops chills, fever and hypotension. What is the nurse's first action? Correct answer is option B. Stop the transfusion and keep the IV line open with normal saline. A patient with Guillain-Barré syndrome develops difficulty speaking and swelling. What is the nurse's priority intervention? Correct answer is option B. Prepare for intubation. A patient with myasthenia gravis is prescribed pyridostigmine. Which finding indicates toxicity? Correct answer is option B. Muscle fasciculation. A patient with Addison disease is admitted with vomiting and hypotension. Which lab result is most critical? Correct answer is option A. Sodium 130. A patient with a DVT is started on heparin. Which lab test monitors therapeutic effectiveness? Correct answer is option B. A patient with a subdural hematoma develops a dilated pupil on one side. What does this indicate? Correct answer is option A. Increased ICP and brain herniation. A patient with Cushing syndrome is at highest risk for which complication? Correct answer is option B. Infection. A temperature with a thyroid storm has a temperature of 104. Which intervention is most critical? Correct answer is option B. Apply cooling blanket. A patient with SIADH has a sodium level of 118. Which intervention is most appropriate? Correct answer is option B. Restrict fluids to 800. A patient with a STEMI is given nitroglycerin but continues to have chest pain. What is the next step? Correct answer is option A. Administered morphine. A patient with a peptic ulcer is positive for H. pylori. Which treatment is most appropriate? Correct answer is option A. A patient with osteomyelitis is prescribed vancomycin. Which lab value is most important to monitor? Correct answer is option A. 1R creatinine. A patient with sickle cell crisis is admitted with severe pain. Which intervention is most appropriate? Correct answer is option B. Apply warm compresses. A patient with a T5 spinal cord injury developed a severe headache and hypertension. What is the nurse priority action? Correct answer is option C. A patient with a pneumothorax has a chest tube in place. The water seal chamber stops bubbling. What does this indicate? Correct answer is option A. The lung has a re-expanded. A patient with a potassium level of 2.9 is at highest risk for which complication? Correct answer is option C. Ventricular tachycardia. A patient with a history of gout is prescribed allopurinol. Which instruction is most important? Correct answer is option B. Drink 2 to 3 liters of water daily. A patient with a history of DVT is on warfarin. Which INR value indicates a therapeutic level? Correct answer is option B. 2 to 3. A patient with schizophrenia taking clozapine has a white blood cell count of 2800. What is the nurse priority action? Correct answer is option B. Hold the dose and notify the provider. A patient with a history of opioid abuse is given naloxone. What is the nurse priority monitoring parameter? Correct answer is option A. Respiratory rate. Which of the following is the most indicator of effective peripheral tissue perfusion? Correct answer is option C. Capillary refill time.